Hello, my name is Jim Gardner. I'm the Medical Director at Blackpool Teaching Hospitals NHS Foundation Trust. This is my COVID update on Wednesday the 4th of August. Thank you to Graham for doing the last couple of updates. The situation today is that we've got 30 COVID positive inpatients. There are 6 in critical care and 24 on the general wards, and there are another 10 patients who are beyond 14 days from their first positive diagnosis who are also with us, so that would take us up to 40. But this time last week the numbers were higher than that. We had 43 active COVID positive patients against 30 today, so fingers crossed we're starting to see another reduction in our COVID positive inpatient numbers. But we are seeing some very poorly people, and I'm sorry to say we've had 4 more COVID related deaths to declare in the last week, so condolences to the families of those people involved. It reminds us that COVID still is and can be a very dangerous illness, and we've seen some instances in pregnant ladies, and I just really want to re-emphasise the point that for ladies who are pregnant, the vaccination is indicated, and it's really important for the protection of the mum and the baby. So please, if you find yourself in that category, will you come forward and have some immunisation? It's in your interest and your baby's interest. Community-wise, we saw a very steep peak, didn't we, 2 weeks ago, where the prevalence in Blackpool was over 800 per 100,000. Really scary numbers, the highest numbers we've seen through the whole of the pandemic. I'm pleased to say that peak was very sharp, and Graham reported last week that it looked like the numbers were coming down, and they continue to do that. So today, the prevalence per 100,000 for Blackpool is showing at 491, whereas last week it was 686. For Fylde it's 344 against 526 last week, and for Wyre it's 334 against 539 the week before. There could be lots of reasons for that, schools closing for the summer holidays, but surely also some really important behavioural things that everybody is abiding by. It's still so important to think about your own safety and other people's safety in terms of wearing masks in public places and in terms of social distancing, and of course our old favourite hand washing, which is still shown to be the most effective way to remove the virus from hands and from transmission. So really important to think about those basics still. Immunisation rates continue to creep up, and that's really important. It still seems to be the most important part of our armamentarium, if you like, to deal with the condition. So we've now got 69% of all adults in Blackpool having had 2 doses. It's 78% for Fylde and 79% for Wyre. Blackpool Council have got the vaccine bus still moving around, and the details of where that is are on the Blackpool Council website. So if you are an adult who has not had either first or second dose and you want to get that done, there are very easy ways to access the system to make it happen. Of course, you can access the NHS.uk website or 119 to get access to vaccination as well. So important. We continue to see our emergency department extraordinarily busy, with daily well over 200 attendances, and on some days over 100 ambulances coming to the department. So I've got to keep reminding people that if you've got concerns about your health where the condition is perhaps urgent but not an emergency, please will you think carefully about how you access the system, and NHS 111 is always there to offer advice, or the NHS.uk website is there helpful as well. So perhaps lastly, although the numbers are dropping, people are still developing symptoms. You can get your own lateral flow kits if you're an adult from any chemist for free, so you can test yourself daily if you want to. And if you are symptomatic, it's really important to get a proper PCR test. And the way to do that, of course, is through dialing 119 or the NHS UK website. We've been very good across the Fylde Coast at getting tested, and it gives us really good data about how the condition is going. So it's so important important to be clear about the situation. So any flu-like symptoms really would be a trigger to seeking a PCR test and checking it out. So that's it for today. Thank you so much for all your care and attention. Please look after yourself. Think about others as well. I'll update you again next week. Thanks.